If your partner is okay with a little bit deeper tissue massage, you're noticing a lot of knots in the neck. Typically, a lot of knots in the neck and shoulders can be other issues, so this won't actually solve those things, but it can feel good for the time being to kind of decrease some of the tension in the muscles. So if your partner's okay with a little bit deeper tissue, we can start working on that kissing thumbs technique. I like to go from the outside of the shoulder on the way up. Really just personal preference. It helps me find some of the tight restrictive tissue and be able to work into that a little bit. And then I'm just working my way up. You can use the kissing thumbs technique. If your thumbs are pretty strong, you can also use it with the fingers, just digging a little bit deeper until you find a couple of the knots. And starting with just the shoulders, maybe I'm finding a lot of knots here. I can just sort of leave my hands in one spot, have the person take a couple breaths until those start to relax out, and then move my way back up the tissue. Again, finding here can be a little uncomfortable, and so if your partner is more uncomfortable when you're in that area, or they're starting to complain of like a headache, then just go a little bit softer and continue with that warm-up technique that we did. Because again, we're not trying to fix anything, we're just trying to loosen up some of this tight tissue. So I like to use my fingertips. You can also use your thumbs as long as it doesn't feel like you're choking the person. And working my way up. One area I really like, it's called the suboccipitals. So people tend to be really tight here, especially if their head juts forward quite a bit. So you can take both of your thumbs and find right at the base of the skull and just slowly pull out right on those suboccipitals. If your partner needs to be a little bit more relaxed than this, they can rest their head on their forearms, say on the counter, and you can do it this way. If it's comfortable for them like this, you can do it right there. Again, if we're working with just one hand, nothing changes. I can still find that little knot, hold it while they breathe, and then work my way back up the neck. And then for the suboccipitals, I take just one side at a time. This way, just one side at a time, out that way. Working up the base of the neck all the way up to the top. Really light, really gentle. If your partner has any issues with, especially as you're doing any of these techniques, if they're a little bit nauseous, if they get dizzy, immediately stop. Definitely not meant to stir anything up in the neck. If they have a long history of cervical stenosis or disc bulging, you just want to be really gentle. We're just going with the outside tissue. We're not trying to push on the neck. We're not trying to change any neck mechanics. This is just really soft, really relaxing techniques. That's all we're going for.